Hello there, folks. This is the regenerative radiologist, Dr. Rahul Desai, and we are going to be talking about photobiomodulation today. So I have my Red Vive Chief Medical Officer hat on today and want to go over a very cool, we'll do some literature review. So I'm going to present an article that I thought was really interesting, compelling, and innovative around the field of photobiomodulation or red light and near infrared light therapy. I'm going to present the PowerPoint that I made based on this journal article that came out this month of September or November of 24 and just recently was published. It's original research in the Journal of Cosmetic Dermatology, and the goal of the study was to look at potential effects in reducing fat, so adipose, fatty tissue, in the abdominal region, simply by shining irradiating. It sounds irradiation sounds scary, like radiating, but this is with safe light, so red and near infrared. So irradiation is the term that we'll use when we're shining light on tissue. So irradiating that tissue with light emitting diodes. So in your LEDs, like the lights we put up in the ceilings, so a light emitting diode that's emanating a certain wavelength of light and a certain energy of light. And so these light emitting diodes are emanating red light. So your red light therapy, but also near infrared. So in that the non-visible spectrum. And so what they were looking for was by simply shining light on tissue on the abdomen, could you reduce fat? Can it cause fat burning thermogenic effects? And what can they learn from it? Very elegant, beautiful study, 90 patients and women aged 30 to 35. The body mass index was between 18.5 and 30, or 29.9, and skin fold thickness greater than a centimeter and a half. And they did a couple of different measurements on the abdomen. There were three groups. So a sham group, so received fake light. The LED group, which received both the red and near infrared variety of therapy. And then the LED group, and sorry, I didn't finish this, the LED with a dermocosmetic. And so that was one that they actually placed some cream on the skin that was thought to help with lipolysis or fat burning. So you had a sham with no light, a LED therapy with red and near infrared, and then the same LED, but including a fat burning cream, dermocosmetic treatment. So this is another visualization of that. So those three groups, it was done twice a week. Sessions were around 3 minutes, and they had a total of 10 sessions, so about 5 weeks. The assessment, so what they looked at was height, weight, perimetry, so basically a tape measure around the circumference of the abdomen. They did ultrasound examination, so they actually looked with ultrasound at the thickness of the fat layer, which is very, I think, elegant, and I'm glad they use that as a radiologist. So looking at the thickness, they had a patient satisfaction score, and another really cool thing they did was actually did a histologic, biopsy of the tissue, and they looked at what was happening with the tissue. And so they did assessments. Obviously, not the biopsy was done afterwards, but histologic appearance of the tissue initially at 5 weeks and 10 weeks. They did all these measurements. The histologic sample was only done at the end. When they looked, as far as like the technique, the wavelengths were 630 in the red, so 630 nanometers, 850 in the near infrared. The irradiance was 0.033 watts per centimeter squared, so 33 milliwatts per centimeter squared, or 39. So a decent energy, not the most powerful light. The red Vive lights that we use are actually significantly more powerful. And the irradiation time was about 3 minutes or so, 2 to 3 minutes, with the red and near infrared. They did this sequentially, and the sessions were 2 times per week. This dermocosmetic application, so basically using these cosmeceuticals that were, varying. And I'm not really familiar with some of these things, but these products that are deemed effective in reducing local fat and improving skin health, they were applied to this third group. The findings, what they saw was there was overall dramatic and significant reduction in body fat, both in terms of perimetry, so the measurement around the abdomen, as well as the thickness with ultrasound on there was a significant difference between the sham groups, which lost none, and the LED groups, and both the LED groups. What was interesting was that there was no additional benefit using the dermocosmetic. Actually, it didn't work as well. They didn't go into a deep discussion of why they thought it didn't work, but one of the possibilities is that it was blocking some of the light by applying this to the tissues. Maybe some of that energy wasn't penetrating into the deeper tissues. There was a significant improvement in the skin appearance and histology. So the biopsies that they did, there was dramatic improvement in collagen deposition and macrophages. So there's active cells in the subcutaneous fat and the fatty tissue. Again, pretty amazing as far as what was happening with the tissues, and we'll take a look at that. The thought process of what's actually moving this, we know the mitochondrial activation, and we can talk a little bit more about that in some of our other lectures, and we've talked about that before. But mitochondrial activation, so increased energy production and supply, upregulation of cyclic AMP, so it's going to actually activate stores of fat burning within the cell, and so you're going to increase utilization of fatty acids in the cells, and increased reactive oxygen species. So actually creating some oxidative effect and killing off some of the fat cells. So that was, this increase in ROS induces formation of these transient pores in the adipocyte membranes so the fat cell membranes, and then allowing intracellular release of the lipid content, so it's more available for burning. And then activation of this protein kinase, which is an enzyme responsible for induction of cytoplasmic lipase, which makes the fat content more available and subsequently be catabolized or used by the body. So it's kind of causing this local catabolism and breakdown of the fat. So all of these things were measured and showed improvement. And this is just an example. They did not demonstrate their measurements, but wanted to show you folks as far as when they're looking at ultrasound imaging and what would they be looking at. This is an ultrasound image of fat, subcutaneous fat. And you see the skin, the subdermis, and then this area, you can see this bright line right here, and a bright line, that's the superficial fat layer. So that's actually the fat that it's going to penetrate. It's going to penetrate a few centimeters into the skin and the tissue, and it's going to affect these fatty cells directly. It may have effect on the deeper fat. And this is, we thought here, the term fascia used a lot, and this is a fascial layer between the superficial and the deep fat. You can see how well you can demonstrate that and how easily and precisely you can measure it. They looked at satisfaction rates. All the groups showed that they were highly satisfied because it's a very benign process and procedure. They did the tissue staining and photomicrographs. So they looked at the tissue. And what we see here is they're looking at fibroblasts. So these little darker purple dots that are scattered throughout, those are fibroblast cells and macrophages. And you can see that there's many more in this LED group versus the sham group and versus the LED plus the dermocosmetic group, so the LGD group. What was interesting here is not only you can see that there's much more pink and it's much more condensed. That's collagen. So the pink staining here is, they're seeing dramatic increases in collagen production. And we know that with red and near-infrared light, there are lots of studies that are coming out on skin health and soft tissue healing. And we use it a lot in musculoskeletal care, and that's talking about this collagen production. And then they looked at these fibroblasts. Fibroblasts are healing cells. They can break up scarring. They can help with cleaning up areas of inflammation. So fibroblasts and macrophages can be anti-inflammatory and pushing more towards a healing and anabolic state. And so we're seeing more activity. These are the other macrophages that they saw, the CD68 positive. So that's a marker, surface marker on these types of macrophages. And these are actually macrophages that will break down fat. So it's looking at this inflammatory cell, and they're showing that was significantly increased in this. You can see sham, no change. Here we see a dramatic increase in the CD68 cells, and then the LED plus this dermocosmetic is about half as active. So there was some benefits to having the light emitting diodes by themselves. Here's another example of the sham group, and these are looking at the fat cells, which is really interesting. You can see these large, full adipocytes full of lipids, so full of that lipid layers and those fatty acids. And here you see the middle B and E. This is looking at the macrophages. So these fibroblastic macrophages, the collagen production and loss of all of this fat. So you have shrinkage, and that was the discussion about these pores that are opening and then the lipids being more accessible. And you have this collagen, deposition. So you're burning this fat, you're reducing the abdominal circumference and your body contouring with simple light. So really cool. You can see these CD68 cells are really prolific here. You don't see barely anything here. Here you see all these dark dots here. Those are those CD68 positive macrophages. And for some reason, this dermocosmetic group, they saw a significantly less active, metabolically active tissue. So what's the conclusion? It's really cool. It's that LED or photobiomodulation therapy, so light therapy with red and near infrared in a 630 nanometer wavelength and an 850 nanometer wavelength was effective and safe at mobilizing the fat content within adipocytes in the abdominal region. So spot reduction, you always talk about you can't do spot reduction. There are new technologies that use cryoablation. We have the Emsculpt Neo using radio frequency ablation to cause apoptosis of fat cells. Amazing technology, very powerful. And this is another one that's pretty awesome to see the benefits. It's also very easy. It's very cheap. You can take it home and you can dose extensively and very safely. So really innovative study. And hopefully you guys got some good information out of this. If there's any questions or concerns you have, please reach out to myself or our team. If you'd like to know more about RedVive technology and photobiomodulation, please visit our website and spend some time on that. And hopefully this is helpful. And we'd like to roll these types of podcasts out there and educate our folks. Thanks. Bye-bye.